I'm joined today by Dr. Kailash Narasimhan, and we are going to talk today about eyelid surgery. Probably not something that a lot of people talk about very often, but he's with the Swami Clinic and TMC, and people come to you with saggy, heavy eyelids is the complaint, right? Or saggy, heavy eyes, and those can make you look kind of tired too. I imagine that would be one of the complaints. So tell me a little bit about eyelid surgery, how it's done, who qualifies, those types of things.
Well, thanks for having me, Maureen. Eyelid surgery is typically done in patients that have excess skin or excess fat. They often complain of puffy eyes. And as you said, many of them feel fatigued and they want a more refreshed look. And it can be in the upper eyelid or in the lower eyelid.
That's interesting because, you know, a lot of us probably haven't thought about that extra eyelid skin. Who would be a good candidate for this?
Typically patients with that kind of anatomy, they typically have a lot of skin redundancy, particularly in their upper eyelids. Also, there's an area called the tear trough where patients can have a lot of deepness. Now, patients also complain sometimes of dark circles under those eyes. That can be for different reasons, but it's just good to see a qualified specialist to evaluate whether they're a good candidate for surgery or not.
Okay. Do you correct the brow and lower lids at the same time?
You can, and actually that's a good point. A lot of patients think that they often confuse the eyelids with the brow and think that their eyelid needs surgery when often it's their brow that's drooped that may need some correction. But we do that very often, and that's part of the periorbital region around the eye, which can be made to look more youthful with surgery.
What's the recovery time like for the surgery?
Typically, I tell patients that it's 2 weeks after the eyelid surgery. They're going to expect some puffiness and some dry eyes initially, and some swelling. Patients are usually kept elevated, but I tell them not to do anything that's going to increase their heart rate or blood pressure. Many cosmetic surgery patients are very physically active, so I tell them to restrain themselves for that amount of time.
Okay. Are there any other non-surgical procedures that will help give us a more youthful look?
Yeah, and I think that's a good point, particularly now that we've understood how to use some of the non-surgical modalities, particularly Botox and fillers. Botox is very effective for deep lines on the forehead and deep creases. And it can also give a slight brow elevation in some patients. It's a good technique. It's also used for crow's feet. Facial fillers are good for volume augmentation, typically in the cheek. But I always tell patients it's a combination of non-surgical and surgical that they can use. But for excess skin or fat, then we typically go with surgery as the most effective modality.
Okay, all right. Well, Dr. Narasimhan, thank you so much for joining us today.
Thank you for having me.
We'll be right back.